So I was just going to do more a practical discussion about diabetes and how we manage patients who become sick. Go ahead and advance the slide. So many problems can cause problems with blood sugars, as we know, and those things can include infections such as the flu. If patients are fevered, if they have the common cold, if they're having any issues like a gastroenteritis, such as nausea, vomiting, and diarrhea. Next slide. And so the things we want patients to know is to always be prepared and have a plan in place so that, they're not scrambling at the last minute or calling you on Friday at like 5 o'clock or having to call, the on-call doctor. So hopefully we can keep them out of the ER and safe at home. So we want patients to know, when they need to call. And in most cases, it's when they're, having things like vomiting, diarrhea over an extended period of time or fevers that aren't coming down. We want them to know that they need to know, obviously, when you're sick, your sugars can do lots of crazy things. So they should be checking more often from their baseline. They also need to know what things they can have in terms of fluids, liquids, and foods, and how to adjust their either insulin or their oral agents when they're sick. If they're diabetic type 1, we do have patients who can dip their urine for ketones, which can kind of just be an indicator to them if this is very bad and at what point they need to get into the hospital. And also they need to know ideas about over-the-counter medications that they could use. Next slide. So things on hand that's nice for patients to have would be things like that can prevent the diarrhea or the nausea, pain relievers, thermometers, testing supplies, obviously. And then in terms of drinks, you want to, just because they're diabetic, it doesn't mean they shouldn't ever have liquids or types of foods with carbohydrates. But when they are sick, they are going to need to keep hydrated, and they're going to need to have some carbohydrate because they may have some insulins on board that need to at least have food or some kind of carbohydrate on board so they don't get hypoglycemic. So I tell them, sports drinks, juice boxes, soups, gelatin, of course your crackers, things that would be easy to digest or keep down. Next slide. So if a patient gets sick, I usually recommend, it depends on their severity of their diabetes, but anywhere on average every 2 to 4 hours. And some people I even tell, if they're really acutely sick and they're having to give insulin and they're maybe not eating as much, I might even tell them once an hour, just depending on how bad they are. They need to make sure they're keeping documentation of their sugars, their meds, their temperature, and their weights. And typically if the sugar's over 250, they're having vomiting and diarrhea, that's when I tell the type 1s to test for their ketones about every 4 hours, because if they're not keeping down, they could easily go into DKA. And sometimes we do continue medications. In most cases we do, because usually when you're sick, it can make your sugars go up. But let's just say it's somebody who's on insulin and may, be having nothing to take in because they just can't keep it down, then you really want to watch. And you would probably reduce the doses of insulin, say, for instance, in a type 1, but you wouldn't stop, your basal insulin, of course. You're still going to need something along those lines. And then, of course, the main idea is just to keep these patients very hydrated. And even if they can't tolerate a large amount at a time, even telling them like sips of liquids every 15 minutes. Solids, they don't necessarily have to keep solids down, but if they're getting liquids, they could use liquids with carbohydrates. And you can use up to even a cup of a drink every hour if you need to. We'd like them also to avoid like caffeine products, and because it could be a diuretic and just make them lose more fluid. So you have to be careful with that. Next slide. So the things that we really need to be cautious of is if they start developing more acute symptoms or a progression of their issues with breathing issues. If they've got moderate to high ketones in the urine and their sugars aren't coming down and they're still feeling pretty sick. If they can't keep anything down for about 4 hours, typically these are more, I think of these as more like a type 1 diabetic where it would be a real quick progression where you want to get them treated quickly. if they're dropping weight significantly. And also on the other end, if their sugars are so low, because either they've already taken their insulin and they haven't been eating and they just can't get it back up, or it's just recurrent lows, they need to come back into the hospital to get treated. Severe vomiting and diarrhea for more than 6 hours, fevers over 101 for about 24 hours, and just if they're lethargic or very confused, we would want to bring them in. And these are, just guidelines, remember, because you can sometimes, depending on the patient, how well you know them and how well they're able to treat this at home, you might be able to keep them out of the ER, but if you're just not sure and you're worried, it's never going to hurt to send them. Next slide. And then for treatment of lows, we usually use what we call our 15-15 method. So that's the left-handed slide. And so basically you're going to treat with 15 grams of carbs and repeat the sugar in 15 minutes. And you continue to do this until the sugars are up over 70. And then you get them to take in something more complex carb to maintain the sugars. And then if, those are just some examples there, types of things that they could try. One thing I have told some patients, if they have, glucagon, it's the emergency kit. But sometimes we're very reluctant to use that, or family members are. You could even have them, I usually tell them to go down the cake aisle in the grocery store. And they have those little tubes of cake gel, because they could easily squirt that into their cheeks and it'll absorb that way. But other things you can use are usually 3 or 4 glucose tabs will equal about 15 grams of carbs. So just read the label. Each of those are a little different. You could use skim milk, about 4 to 6 ounces of regular juice or regular pop, and so on. There's some examples there. Next slide. And so the forms of glucagon, we have a new one, which is called Baqsimi, the one on the right. It's actually a nasal spray. It's fairly new. It's, I think, less intimidating. And if your patient's insurance covers it, it is a very easy modality to get the sugar up. And this is typically not given by the patient. It's usually if the patient's incoherent or not able to eat or drink safely, then this is something the family would use to bring the sugar up. So it's just basically, it comes sealed. So you wait to undo the sealing on the container, but once you have it open, you just basically squirt it up into the nose, similar to like Flonase nasal spray, somewhere along those lines. And then we also have the injectable form of glucagon on the left, which is a kit. And that one is the one that's been around much longer. But as you can see, they have to inject the liquid into the vial, shake it up, draw it up, and then inject the patient into the muscle. So that's a little bit more cumbersome. It's a little bit more intimidating for patients' families sometimes. And then one thing I would just caution you on, make sure that you're checking the expiration on those items, because they do have an expiration date, and I think it's about a year. Definitely on the kit. I'm not sure about the Baqsimi though. Next slide. So just as a follow-up, the patients should always contact us and let us know if they've either gone to the ER for having issues with sugars. Sometimes they go in, they get everything changed around, and then they come home and they're back to normal, and maybe those adjustments aren't really necessary, or they need readjusted back to the baseline where they were. And if you wanted some nice handouts on the ADA website, they do have some resources for patients about sick day care. So that would be something you could go in and print out that information. I think that's my last slide. Yes. Any questions?
Thank you so much, Renee. That was great. Are there any questions for Renee and the didactic? Feel free to use the chat as well. So there was a question asking, as far as a sick day kit ready to go on hand, what would you recommend having included in those, aside from, the fluids and meals that you mentioned, along with maybe a thermometer? Is there anything else you would recommend?
Well, I would just make sure they have some form of like glucose tabs, and that, you could do the Baqsimi or glucagon, or have it near that, so that they know where they're getting it from. I'd probably say the other thing is somewhere they need to have a list of our current medications. and dosages, because if they get sick enough, and maybe there's someone who lives alone and their family kind of knows what's going on, but maybe doesn't necessarily know what they normally take, they want to have that available if they need assistance, you know, if they got confused, those kinds of things. But really the list that I had provided would be the main items. Nadia, do you have anything else to add? No. And maybe have your doctor's number listed there too, you know, just for family members and that kind of situation. Now I have done this though with the low sugar stuff. I've had patients make up low sugar kits. So they basically, I tell them to get a clear Tupperware container and label it with treatment for low sugars, because sometimes, you know, when you get low, they feel so terrible. They basically go and grab everything and anything in sight, and then they over treat low sugar. So if they've got a little container available with just the items that are pre-measured that show about 15 grams of carbs, sometimes that keeps them from overdoing the treatment for low sugars. But remember, when you're sick too, it's not just lows we worry about. I know I stress that too, but also highs. You know, sometimes they'll get very high when they're sick.
Absolutely, thank you. And would you recommend having them ask about getting a flu or pneumonia vaccine when they recover from their sick day?
Yes, yeah, everybody, any vaccine that's recommended by the CDC for their given age or condition, I always recommend that. So every year, annually, they should get the flu shot. And then there's guidelines on the pneumovax. I think it's before 65, they get a shot. And then after 65, if it's at least a year, they get a booster, or at least 5 years, I'm sorry, I think. And then one more shot after that. I think that's how it goes. I have to look at the CDC again, but yeah, all the recommended vaccines I usually will recommend, including flu, pneumovax, shingles, and maybe even coronavirus eventually.
Thank you. Were there any other questions, comments? Have you all seen similar types of situations with your patients? Don't be shy. This is a safe space. Renee, have you seen any unique situations ever since COVID happened? What has your experience been with that?
Well, we've had some calls. Mostly a lot of the diabetics are just afraid to, you know, go out and do much, which is fine because they are a bit higher risk for complications. But myself personally, I have not had any of my patients have COVID. Nadia, you?
I've just seen the ones in the hospital.
Yeah, she sees the inpatient end, so she's definitely probably had more experience than I, but I mean, I'm just recommending to my patients, like anybody else, you know, social distance, wear your mask, wash your hands, don't touch your face or your eyes. Try to be out of big crowds. You know, take just the normal routine care that the CDC is recommending.
Yeah, definitely.